Remember, for the man with the hammer, everything is a nail. So we all make mistakes, and there are several ways a doctor can make an error. One major reason for a medical error is a bias or our biases. And in medicine, biases can disguise itself in many different ways. So in this lecture, I will show a couple of common biases. So please be aware, this is not a complete list. These are a few selection of biases that I at least want you to be aware of. So before we continue, what is a bias? And let's see the definition here. A bias is a disproportionate weight in favor or against an idea or a thing, usually in a way that is close-minded, prejudicial, or unfair. And an important fact to point out is that biases can be innate or learned. So that is very confronting, that that bias can occur consciously but also unconsciously, because the latter can mean that you might have bias without you knowing it. Therefore, it is valuable to at least be aware of common biases to increase your chance and your odds of catching that bias. So one bias in medicine is called anchoring bias. In anchoring bias, you prematurely settle on a single diagnosis based on a few important features of the initial presentation, and you fail to adjust as new information comes in and becomes available. So anchoring bias is therefore closely related to confirmation bias. In confirmation bias, once you have formed a diagnosis, you have a tendency to disregard information that goes against that diagnosis. And you have a tendency to only notice things that confirm your diagnosis, hence the name confirmation bias. Related to these facts is also the diagnosis momentum. And what that means is that once a diagnostic label has been assigned to a patient by another individual, it is very difficult to remove that label and interpret their symptoms with fresh eyes. So it is very difficult to put away the opinions of or the diagnosis of other colleagues. So that's one of the reasons why a second opinion is so difficult, I think. Another example is it's what's called an affective error. An affective error involves letting personal feelings, whether they are positive or negative, about a patient direct or affect your decisions. This is the tendency to convince yourself that what you want to be true is true instead of less appealing alternatives. For example, if you know your patient, if it is a colleague you've been working with for years on end, and your colleague comes with you with a headache, you are more likely to opt for a benign diagnosis. The reverse is also possible. So when you dislike a person or a patient, you might write off his or her complaint very, very prematurely. So in affective error, the person in the doctor comes forward during the diagnostic process. Another form of bias is assortment bias. So look at this picture. What do you see in this picture? You might, for example, see a chess pawn in the middle of this image. Or you might see two faces looking at each other. So in assortment bias, you see what you expect to see. It usually is an innate process and can get you definitely in trouble as a doctor. An example is, for example, a homeless patient with past drug abuse who's brought to the ER and he's found unconscious. Big chance that your first assumption is that this homeless patient with past drug abuse has overdosed on drugs. However, who's to say that he isn't a diabetic using insulin and in fact is in a hypoglycemic coma? So this is an example of an assortment bias. Both are definitely possible, but what you expect to see can differ. And the final bias I want to talk about is the one that, in my opinion, encapsulates a lot of biases and a couple of traits that might get you into diagnostic trouble, which is, to the man with only a hammer, every problem looks like a nail. It has different names. It's named the law of the instrument, or the law of the hammer, or Maslow's hammer, whatever you call it. It is a cognitive bias that involves an over-reliance on a familiar tool. And in medicine, that familiar tool can be your specialty. If you, for example, are an infectious disease doctor, you might think HIV or tuberculosis more often than a doctor who isn't specialized in infectious disease. This form of bias can cause you to anchor a diagnosis that you are most familiar and comfortable with. So it is a way in which you can have very significant tunnel vision, especially if the diagnosis is something you are not comfortable or very familiar with. So these were a couple of examples. In the next lecture, I will show you how to remedy these biases.